So these are our supplies for the double contrast barium enema. This is the contrast you're going to use. You want to mix it with warm water and shake it really good, and then this is the bag that it's going into. Here's the clamps. This is the cuff inflator, and this is used to put air into the rectum. Here's the tip, and you're going to use some lubricant when you're tipping the patient. Some gloves for the clean procedure. You're gonna make sure that you have the blue pad on the table. So you're also gonna want some towels and sheets ready for you, and a trash can in your room as well. You're also gonna want to make sure that you have a footboard attached to the table, just in case the physician wants to turn the patient at all or rotate them up or down.
Hi Emily, my name is Cheyenne. I'll be assisting you in your barium enema today. Can I have you confirm your name and date of birth, please?
Emily French, August 2nd, 1997.
Okay. Is there any chance of being pregnant today?
No.
Any history of cancer?
No.
So we are going to do our double contrast barium enema that includes air and barium. Have you ever had a contrast procedure done before?
No, I haven't.
Have you ever had any previous surgeries to your abdomen?
No.
You still have your gallbladder and appendix then?
Yep.
Any allergies to latex or barium?
No.
Are you having regular bowel movements?
No.
Do you have diarrhea or constipation?
Yeah.
Any abdominal pain?
Yeah, in the lower section.
Okay. How long has that been going on?
Probably about 2 months.
Did you do your prep for this today?
Yeah.
And what did you do for your prep?
Lots of fluid, nothing but mouth for 8 hours. Took some laxatives.
Okay, and then so I'm going to have you get dressed into your gown and prepared for the procedure today and remove all metal, and then we'll get started, okay? So we're taking your KUB scalp. I have you centered at your iliac crest and your mid-sagittal plane. I've got a marker down here to mark your side, and this is done to make sure that all of your anatomy is okay and that you did your prep. The technique for the Scout KUB is 120 at 2. I have Emily French in room A. She's never had this procedure done before. She's no previous surgeries, no allergies. She's been experiencing constipation. She did her prep and her KUB was sent to PACS for you to check, and I'm going to go tip her right now for you. Okay, we'll take a look. Okay, for the process of tipping the patient, this bag has to be 24 inches above the recumbent patient. You put on your jelly for the tube, and then you insert it starting anteriorly and then going superiorly, and having the patient taking slow, deep breaths. And then you hold it in place by one puff of air and 2 clamps on the patient. My patient is in the Sims position, and I have the bucky tray at the end of the table for the floral images.
Hi Emily, my name is Dr. Van Houten. I'll be helping you with your procedure today, and I have Cheyenne here with me. So we're going to be doing double contrast barium BE. And so basically what we're going to do is have you roll around 360 degrees and coat your colon with barium. And then we're going to take some fluoroscopy images while we're doing that. And then after we're done with that, we'll drain, and then Cheyenne will take some overhead regular x-rays, okay? All right, so we're going to start first by turning you 360 degrees, and I'm going to take some images while Cheyenne helps me with that, okay? So go ahead and turn to your left, take some images, stop. All right, go ahead, keep going a little bit more. All right, go ahead, stop. All right, go all the way on your tummy. Perfect. Feeling okay?
Yep.
All right, keep going. Looks good. Keep rolling. Stop. Perfect. And back on your belly. And back. All right, looks like the colon is filled with barium. So next we're going to drain the bag. Put the bag between her legs on the floor. Perfect. And then we'll wait a minute and then we'll keep going. physician and tech can shield themselves from occupational dose, but unfortunately we can't shield the patient due to the area of interest. However, if breast shields are available, you can use.
Barium was drained and now the bag is placed between the patient's legs, and I have to do 15 puffs of air into the rectum, and the patient may feel discomfort in some kind. So quickly after fluoro images, you get your patient in the left lateral DQ and centering at the iliac crest and MSP with 40-inch SID. Technique is 120 at 2, and you do 2 puffs of air between each image. And then again after the left lateral DQ, you do the right lateral DQ quickly with technique is 120 at 2, iliac crest and MSP, and again 2 puffs between each image. Okay, after your DQ shots, you do another KUB, which is an AP, and you mark it, and the technique is 120 at 2. And the iliac crest and MSP are your landmarks. So after the AP, then you go into the PA, which is again at the iliac crest and MSP, and technique is 120 at 2. So next is a sigmoid, which is 30-degree cephalic angle, centered 2 inches inferior to the ASIS, and make sure to line up your bucky tray with your tube. Technique is 120 at 2. So I checked all of my images and I had what I needed, so I set up for the lateral rectum, which is centered at her ASIS, and then I will deflate the balloon. And uninsert the tip, and then throw it away in the trash. And then I'll take my image and quickly I'll let the patient go into the bathroom, clean up, and change. The lateral rectum technique is 120 at 6. I checked my lateral rectum image and I had everything I needed, so I'll escort my patient to the bathroom to clean up. Okay, your procedure was successful. We had all the images we needed, and make sure to drink plenty of fluids the next few days to flush out your colon. You'll possibly experience white stool and constipation through that process, and your physician will get back to you in a few days with the results. Thank you.